Thank you very much. Thank you, everybody. And it's always worrying, isn't it, when you get so many people sign up, you think if the pressure's on, have they signed up to the right thing? Can I deliver? So hopefully I can. Hopefully it is what you expected and more. And like I said, I'm more like Jill said, I'm here for questions, and hopefully I explain it in a way that you understand. But if not, please, you know, fire away, shout them at me at the end. That's fine. I'm used to being shouted at. It's not a problem. And no question is a silly question. If you're thinking it, I'm sure somebody else in the room is as well. So I'd rather you leave here today thinking, yep, I got the answer to my questions, and oh, I should have asked that. So feel free. Now, with my presentation, I have kind of 3 different levels. I do a very basic one, a very high level one, and a medium kind of one. So I went for the medium today. So we'll see, hopefully we'll see how we go. Let me share my screen. That's always the challenge straight away, isn't it, to begin with? Okay, let's start the slideshow from the get-go. Rightio. Jim and Jill, I just need a thumbs up if you can see my screen. That'll be perfect. Okay, lovely. Right, so I'm going to tell you today about who LiveWell Dorset are. You may have heard of LiveWell Dorset, you may have seen our pretty colours flying around in the GP surgeries all over the place, and quite often we find people refer people to us, and that's fantastic, but not sort of knowing that finer bit of detail. So once people do come to the service, what is it we actually do with these people? So I've gone into some high level, and I don't expect you to know this, you know, it's not homework. I don't expect you to remember everything. It is going to be recorded, and I will send out, if you need the slides or anything as well, and some of the resources and links, I can send those as well, Jim and Jill. I just need to optimize my sound because I'm going to play a video clip. So let me just do that. Share sound. Right, here I go. So the next, you should be able to hear a video clip. If you can't, just let me know.
Do you want to lose weight, quit smoking, drink less, or get more active? LiveWell Dorset provides you with free healthy living advice and coaching. Are you weighed down by extra pounds? Shedding your burden is tough. It takes time, focus, and the support of others. Together, let's loosen those straps and break free from your bad habits for good. Take steps to manage your weight through healthy food choices and physical activity. Find out if you're eligible for a kickstart at your local weight loss group. Drinking too much too often causes us harm. That extra beer or glass of wine can soon slip into a daily habit. Before we know it, we're regularly drinking above recommended guidelines. Drinking less will do wonders for your health. Stress less, think more clearly, feel energized and sleep better. Smoking, that harmful habit that cripples our health and drains our bank balance. Most smokers want to quit, but that doesn't make unwrapping the comforting habit any easier. Life without cigarettes can look cold and harsh. Don't be daunted. Quitting is the most effective thing you can do for your health. Don't focus on the loss. Focus on the gains. Your savings goal, adding years to your life. Feel and look younger. Switch the words "I'm trying to quit" with the mantra "I am a non-smoker." Make your stop smoke plan with support from our coaches. Sitting still can make us ill. Getting up and out and moving has tremendous benefits to our health. Small steps lead to big change. All too often, we don't get our daily dose of exercise. The less we do, the harder it is. Yet, the more we do, the easier it becomes. Use our activity finder to discover new activities on your doorstep. Meet a happier, healthier you through our free advice and coaching. Take control of your healthy living. Call us on free phone 0800 840 1628 or register online at livewelldorset.co.uk. Take your next step to live well.
Okay, I'll just stop sharing my sound. Okay, so that's a bit of a video that we demonstrate, and people can have that in the waiting rooms. If you wanted that animation where you wanted to put it up anywhere on a screen, we can share that with you. That's fine. And it's just like a high level overview of what we deliver. So I will go into the specifics. I not just come here to show you a video today and off I go. So I'll go into those specific areas. So we offer a wide variety of different options. The biggest thing that we deliver is coaching, and is the bulk of what we do. So I'll go into that into more depth. We also deliver different training. We've got different training events that are coming up, online, face-to-face, and I'll share the details of those with you. Because we often hear the word training and think, well, what is that training? You know, is training all over the place? So I'll go into detail as to what the different training offers. We attend different engagement, different events. We're always out and about, and different organisations that we work with. And we've also got a wealth of information on our website, how we signpost people to other organisations, and with our LiveWell Finder and things that we've got online as well. I will also say, you know, we can send out resources as well. So we've got hard copies of flyers as well. If you need any of those for wherever you may be, I can put the link in and we can share that as well. All you need to do is literally pop in your name and address, and some will turn up in the post for you. Okay, so our coaching offer. So we are fully funded by Public Health. So we're a free service as long as you're registered with the Dorset GP and living in Dorset, and you're aged over 18. So we're an adult service only. It looks like this, so sort of 6 20-minute sessions. They're all done over the telephone. Now we are looking at expanding, so doing sort of video calls, and now we can go back to face-to-face. That is something that we are looking into, but just currently at the moment, we're still over the phone. And when we say 6 20-minute sessions, you know, obviously we've got leeway with that. We'll see how people are progressing. We can do more sessions, less sessions. They can be a bit longer than 20 minutes. And that's at a time convenient for the client, for the patient, for the individual. And our services are open from 8 AM to 8 PM, obviously around work commitments. And those telephone calls might be weekly, fortnightly, monthly, whatever that looks like for the individual. And they might start off weekly and then, you know, progress to longer. We also have a platform once you register with us called My LiveWell, and it's a little messaging tool. So if you haven't got a session with your coach for sort of 2 weeks, or you're having a really good day and you want to share that with them, you can do. It's like a little it's literally like Messenger or WhatsApp or a texting service. So your coach is available, not just at that time for your coaching appointment. Now, this is the behaviour theory that we use. You know, this isn't a science lesson of anything, so I'll touch it very high level. So this model, the COM-B model, underpins everything that we do at LiveWell, and it's the core of our approach. So every engagement conversation that we'd have, any interaction with the public, with staff, with partners, stakeholders, this is the model that we use. So we're a behaviour change service. We're not a mental health service. So if people come to us with depression, anxiety, or severe mental health, we would refer them to the correct organisations, such as Steps to Wellbeing or Dorset Mind of the like. So like I said, we're behaviour change. So we look at those behaviours, and everybody that wants to change a behaviour, they come across barriers, and we understand that it can be really, really difficult to change a behaviour, and there is a variety of different stages of change. So it can be really, really complex. So we look at these 3 things on the left-hand side. So we look at the capability of the individual. So what are they capable of currently? So if they wanted to get more active, for example, and they've never, you know, done any exercise, or, you know, they've got a long-term medical condition or a long-term health condition, we're not just going to send them off.
You see, are you showing slides?
Oh, sorry, I think somebody's microphone might have just come off. Sorry.
Are you showing slides? We've still got the LiveWell Dorset end of the video. I haven't seen any slides.
Oh, okay. Okay, thank you for letting me know that. Let me stop sharing then. Thank you. Yes, I am sharing slides. Let's start again then.
Thank you.
No, thank you for that. Goodness. No.
It's a good question, Paul. I was just about to ask a similar thing.
Oh, I do apologise. I was just clicking on through, hoping for the best. So good job it got identified. Sorry about that. I don't know what happened. Right, let's have a look. Can you see the new slide that's got,
yeah.
Looks a bit like a fried egg.
Yeah, that looks good.
Fantastic. Right, so That's brilliant. I'm glad we got there before I go through the whole presentation. So that was just going over the LiveWell offer as a visual representation. So about the 6 sessions fully funded by Public Health. So that's the only slide that you've missed. This is the next slide, that COM-B model that I was explaining about. So to enact that behaviour change. So thank you for that. So yeah, we look at the capability of the individual. So individual circumstances, what are they capable of in regards to enacting that behaviour change? And that can be their physical health, their long-term health conditions. What are they individually capable of? We look at opportunities. So what opportunities do they have around them to enact that behaviour change? Where do they live? What does their lifestyle look like? Do they live near, coast paths where there's walking? Is there green spaces? Do they live in a high-rise building in the city? What does their friend circle look like if they're trying to stop smoking, for example? Do they hang around with a lot of smokers? If they want to stop drinking, are they going to the pub regularly? So we look at that opportunity and those barriers around them. And the last thing that we look at in regards to making that behaviour change is motivation. So what is the motivation for them to make that change? And that's something that we'd ask them initially. So, how motivated are you? How ready are you to make that change? Because sometimes people aren't quite ready. And unfortunately, it can be sometimes where they get some really bad news that motivates them. So they may be waiting for hip surgery, for example. However, they can't have that surgery because they need to stop smoking or they need to lose weight. So that's, it's a motivation because something's got that bad that they need to now make that change. But sometimes it can be a really nice motivation. So we've had women come to us who are smokers and they're now, they're having a baby, they're pregnant, so they want to stop smoking. That's a really nice motivation. Or elderly men and women have now got grandchildren, they're looking after them and they can't keep up with them, they're running around in the garden, so they want to get a bit more physically active. And when we talk about physical activity, we like I said, it's not just running. So that's what everybody thinks. It's different exercises we can do at home. We can signpost you to different organisations, different groups, and some of those are free as well. Well, most of them are free that we've got on our LiveWell Finder. So our coaching offer, I'll go into in a little bit more depth, and it is the bulk of what we do, so it takes the longest of everything. So we help people to stop smoking via coaching, and there are 3 sort of different options that we would provide if they came through to the service. Some of them you might be aware of. So we have this 12-week stop smoking offer. I'm just going to check before I keep talking. Can everybody see my smoking cessation slide? I'm hoping that we're all on good track now. I think we are. Sorry, I can't see anybody.
Yeah, we can.
Great.
Sorry.
Thank you. I didn't want to carry on if you couldn't. That's fantastic. So what that program looks like is we triage the individual to their local pharmacy, but their local pharmacy needs to have a stop smoke practitioner in it. So that's the only eligibility. So if the pharmacy didn't have one of those in, unfortunately, they'd have to try and find one locally to them that did, or there are other options. So that's the eligibility criteria. And if they receive 12 weeks of nicotine replacement therapy through their stop smoke practitioner at the pharmacy, and they would get 6 support sessions, so that's coaching sessions through the pharmacy. They've got the option to have our LiveWell Dorset coaching offer alongside that, or before and after if they wanted to. Most people don't take us up on it because they've got that with their pharmacy already. Now, the only eligibility for that is if people pay for their prescriptions, they would pay for their nicotine replacement therapy. If they don't pay for their prescriptions, they would get that for free. So we at LiveWell offer a similar offer, and that would be for the people that haven't got a stop smoke practitioner in their pharmacy nearby. And this offer is completely free. So depending on how much the individual smokes, we would send them about 8 to 10 weeks of nicotine replacement therapy. That gets sent out through the post. So that's gum and patches. And we understand these options might not be for everybody, but if this could be an option to try, if people haven't tried it before, or it has worked for them in the past. Again, we're all about coaching and behaviour change. So all of our offers come with the coaching offer. So they'd have their 6 LiveWell coaching sessions at a time convenient for them. But one thing that the feedback we've had that they do really like is we distribute these carbon monoxide reading monitors. They get sent out in the post so they can track their lung health. And what's really good about those, it's really interesting about how their carbon monoxide reading levels drop when they do it when they have a cigarette, and if they haven't had a cigarette for a few hours, they can really track how much it's dropped. And it's a good motivation because once they have another cigarette, their levels are going to be up high again. And that's something they can discuss through with their coach. We also offer e-cigarettes and vape. Now, I will mention here, we can support people to stop vaping and stop using e-cigarettes as well. So we understand that people might think, oh, you know, going on to vape and e-cigarette is replacing one habit with another. So we can support people with that. And this is an option if people haven't tried it before, or might be something that they do want to try. So we get this sent out from our provider, and it's 6 weeks, and it's an initial starter kit of products. We've got various different strengths, colors, all sorts. There's all different flavors. It's a new thing that seems to be quite common now. Again, we'd have our coaching offer alongside that with the carbon monoxide readings. Again, we understand this isn't for everybody, but it's an option that we can provide. Again, it's all free. So that's our smoking pathway. We also help people with weight management. So we help people lose weight, but we also help people put on weight as well. So I think we always think about weight management as people losing weight, but we work quite closely with the homeless charities, with Lantern down in Weymouth and Portland, and with Reach, the drug and alcohol services. They quite often refer people to us because people want to put on weight as well. 2 options for this. We can offer a weight management kickstart program via Weight Watchers or Slimming World. So we can offer 12 weeks for free. There is an eligibility criteria depending on BMI, but everybody's different, and we can talk that through with the individual on the phone. Again, they can have our coaching offer alongside that, which works out really nice because they can go to their groups, get their weigh in, chat to their, other people within the group, but they've also got the coaching session with us, so we can check in and see how that's going. And this is the only thing with this is the Kickstart referral, and it can only be accessed once. So the 12 weeks of free vouchers can only be accessed once. They can't access it again. However, if they've been a paying member, they can access it, and also obviously they can pay. That's fine. So our behaviour change is another option that we do. So if Weight Watchers or Slimming World wasn't suitable or they weren't eligible, we can offer our behaviour change coaching around that. And we work quite closely alongside the NHS. There's a weight loss plan that we can forward them on to, different approved weight management plans as well, and different signposting elements that we've got and different organisations that we use. We work really closely with Active Dorset, so they help people, they've got expertise with physical activity relating to long-term health conditions. So we work really closely with them, offering, because obviously weight loss goes quite nicely with physical activity as well. Obviously, the more you're active, the more you're going to be able to manage your weight. So, and our coaching offer goes alongside that too. So our physical activity pathway, we want to encourage people to get more active. They say, 30 minutes, 5 times 30 minutes a week is what we should be doing. And it's interesting, so I speak to a lot of people and I say, are you physically active? And they say, yeah, I'm really busy at work and I run around after the children. But that's not what we mean. We actually mean dedicating some time to yourself where you're doing physical activity and you're raising your heart rate. So we offer our coaching offer, obviously, alongside of this, so we can do regular check-ins, see how we're going. There's a programme through Dorset Council called Active for Health. They need to be referred by a healthcare professional. There's also exercise on referral that's a little bit of a grey area with the GP surgeries, because we don't have access to clinical records. We obviously can't signpost people to certain gym programmes, but we have got our activity LiveWell Finder, which demonstrates different walking groups. Basically, we'd find out where they live and type that in, find out what they like doing, and then all these different activities can come up in their local area. And we've also got a variety of different tools for exercises at home for long-term health conditions as well. So we can hand those out, and we work really closely with Active Dorset, as mentioned before. So our alcohol pathway is the 4th one, and we're nearly done on the coaching element. Like I said, it would take up the bulk of the presentation. So we help people to reduce their alcohol intake. Now, we always say, everything's fine in moderation. However, if people came to us as high risk, so if they were alcohol dependent, so drinking every day, for example, we'd always do our health risk assessment with all of these pathways. And for the alcohol, we do an audit, it's called an audit C assessment. So we find out how much they're drinking. If they were dependent, then we would refer them to a specialised drug and alcohol service, such as Reach or EDAS. If they're medium to low risk and it's becoming a little bit of a problem, and they're in that medium category, it's just something they need to be aware of, we're more than happy to offer them our coaching sessions. We can offer our coaching sessions if people are high risk. We just get them to sign a declaration form to explain that we've said this is probably, it's probably best that you do go to a drug and alcohol service. However, we wouldn't just say, no, we're not happy to help if that's something they've tried in the past. Yeah, and we've got different alcohol reduction programs that we look at that we can signpost people through to. That whole waiting well, so if there's a little bit of a wait, when we signpost these people through to these services, we can support them through those periods as well. And we've got our activity finder, as I mentioned before, because it's always good to sort of replace one habit with another habit. So, we look at their habits around drinking alcohol. When are they drinking? What's around them? What does their social circle look like? Is there anything else that we can introduce into their life currently that may reduce that alcohol intake? So that's our coaching offer for our 4 pathways. We also deliver training. So training is, it's because it's fully funded by Public Health. It's RSPH accredited, so the Royal Society of Public Health. So you leave with a certificate. It's in your CPD file. It's for the public sector, for charities, for volunteers, organizations, so that this, people who within the PPG would be eligible for this. So obviously within our roles, we look at well-being, well-being in others all of the time. We're quite used to supporting other people, but when do we stop and look after ourselves and think about our own well-being? So these are online. They can be done face-to-face in group bookings, and I'll send the links through if people were interested in booking on, and I deliver this alongside 2 of my colleagues. So there's 4 courses that we provide, and that's, we look at the bottom one there in the green. We look at top tips for your self-care, so your own well-being, and that can be in your personal, your professional life. They quite often overlap. And then also well-being essentials for others. So that's identifying signs in others that, we always say to someone, are you okay? Yeah, I'm fine. But how do we identify those signs if we understand that well-being may be an issue for them, or they might be going through something currently? And also how to have those conversations. So we're all MEC trained, so making every conversation count. And open conversations, so bringing the best out of that conversation, we deliver in that one. And then we've got our top 2 courses that are a little bit longer. So the bottom 2 are about 2 hours, and then the top one is about 4 hours, so half a day. And we look at wellbeing essentials for teams, so that can be within the workplace, and we have wellbeing champions. And we share best practice in there. So what are people doing for their well-being? Are they going out walking on their lunch breaks? And, are they keeping physically active? Is there organisations within their organisation that they can signpost people to? And then wellbeing essentials for managers, that's anybody that line manages people or supports people, within their role. And that's about role modelling. So as managers, we often quite get engrossed in, not taking lunch breaks or whatever, or, just helping others all the time. But when do we actually stop and look after ourselves? So role modelling that down. And people can come as organisations to those. They can come together, or we've got set dates in the diary. And that works quite nicely because people get to meet other people from organisations and share their findings. We've also just released the nutrition course online as well. So I probably should have added that to the slide, actually. I've just remembered. And that's about supporting people with nutrition. So we're obviously looking at the cost of living crisis currently. We've got a bank of all the different food banks and different food access groups available in different areas. We work quite closely with them. So it's about supporting other people with their nutrition and just making them aware, of portion sizes and things like that. And then we've also got a similar course, which isn't available just yet, but in the pipeline is smoking cessation. So just looking at facts and figures around smoking and what that can look like and how to support other people and the correct language to use. So I won't go into too much detail in regards to where we are, and I'm sure you're not really, bothered about what I do on my day-to-day, but we're always out in different engagement and different events. We work with a variety of different organisations. We're fully integrated in we work really closely with the NHS and the outpatient assessment centres. So just in case you're not aware, I'll just give you a bit of a brief overview as to what they are. There's one in Bills in Poole, and there's one in Southwark's House in Dorchester. And what they were originally set up for was during COVID, obviously waiting lists just were never ever ending. So they set up these temporary building spaces where people could go and they could get through those waiting lists. So they have different clinics on different days, and a patient would come in there, as they would do in a hospital, see their physio, surgeon, clinician, and then they'll come and see LiveWell at the end of that. And that might be for, like I said earlier, people, we go to a hip clinic on a Friday, people might come to us because they need to stop smoking or lose weight. So we look at that whole behaviour change. So the whole purpose of LiveWell is that prevention at scale. So if we can target you before it's too late, you know, if we can get you to eat healthy, stop smoking, you know, keep physically active, in regards to long-term health conditions, that can be reduced. So hopefully having less impact on the NHS. So yeah, the whole prevention at scale. We're integrated into the GP surgery, so we all work in different PCN areas. So I think there's 3 of us, and we've all got about 4 or 5 different PCN areas across Dorset as well. These are some of the organisations that we work quite closely with, but to be honest, it's, you know, you can't fit them all on one slide. It's just a bit of a visual demonstration, really. Work with Help and Kindness, Help and Care, obviously the social prescribers, we work quite closely with them, Dorset Mind, Active Dorset, and obviously Steps to Wellbeing. We also do health MOTs. Now, what they look like, we do 2 different versions, really. We do a virtual one, which can be held over Teams online, and that's a 20-minute confidential one-to-one health session. And what that looks like is we'd have a discussion around current, you know, lifestyle choices and what people are currently doing within their lifestyle. And we've got some different online tools that we can signpost them to, depending upon, you know, things that they may wish to change within their current lifestyle. And again, they're free, they're open to Dorset residents aged over 18, they're fully funded by Public Health. And we also do face-to-face ones. So we've got some sessions coming up in the libraries in the Dorset Council area. So I can send that across to Jill and James as well, so we can get those sent out if people wanted to go into drop-in sessions in their local library. And what that looks like is we would take heights, weights and blood pressures, and we'd look at BMI, and we'd look at your current lifestyle around those stats and figures. Obviously, we can't do those virtually. But yeah, they've been really, really popular. We was in the Weymouth Information Shop. People have come in for drop-in sessions there. And we can also go into organisations and do these as well. We've got about 12 of us that go out and do these on a daily basis. I'm in Weymouth Library all day tomorrow doing them. So it's you know, it's great to have those conversations and have those, you know, blood pressures taken as well, and just talk about current lifestyle. The entry to the service is really, really easy. So people can self-refer. They don't need to be referred by a healthcare professional, but healthcare professionals can refer, and there's a really, really quick registration process online, which people can fill out, and it's just taking names, dates of birth, email address, or mobile number, or whatever that might be, getting people registered. Once they've entered the service, an advisor will call them within 48 hours to have that initial consultation with them and work out the best intervention or support, whether that might be coaching or signposting. And then, yeah, they can come on through to the service, have their coaching offer. And we also do follow-ups as well. So once we've sort of, you know, they might have set their stop smoke date and they've stopped smoking, or, you know, they what's the word, when they, yeah, like they might not need to be with the service anymore, but we do follow-ups with them. So we close their file, we say, thanks very much, you know, let's see how you get on. We'll check in with them in a month's time, 3 months' time, 6 months and 12 months, just to see how they're getting on and if they need any further support. And if they've accessed LiveWell for one pathway, so maybe it might be for drinking, but they then want to contact us at a later date for smoking, that's you know, that's fine as well. You know, people can contact us as much as they wish. It's only the Slimming World and Weight Watchers offer that's a once in a lifetime option. Yep, so like I said, registering your patient on the website, it's really, really easy. There's 2 options, and you can use the Contact My Patient, which is just putting in details, and they would receive a text message, or you can do the full registration process. I can send through a little video and some little instructions about how to do that if you wish.